Well, good afternoon. It is good to be with you all today, all over the beautiful state, and it's good to join Dr. Box and Dr. Weaver again as we close out this year, and what a year it's been. We've had our ups and downs in terms of our public health, but we started the year with a successful rollout of the first COVID vaccinations, and got off to a great start with rshot.in.gov, giving citizens the information that they need to make safe decisions. There are more treatments now than there have been in the past to help folks who are ill with COVID, and there's more coming soon. Clearly, Hoosiers have more information. They're better equipped to make those safe decisions than certainly the first year of COVID-19. But we continue to get some curveballs thrown at us, and I'm thinking of variants specifically, thinking of Delta and Omicron, and that have both crisscrossed the globe, crisscrossed the country, crisscrossed Indiana, and really taken a couple hard whacks at our populations. It's challenged our recovery efforts for sure. There's no way around that, but thankfully our heroic healthcare providers and our hospital networks, those who are caring for the folks who are sick, and I have to say today, an overwhelming numbers in terms of unvaccinated folks who are sick ending up in the hospital, more so than certainly ever before. I also want to say just at the outset here that there are not enough eloquent words in the English language for me to say thank you to those individuals who complete shift after shift after shift, who have been doing this for going on two straight years now, who are saying prayers for people at their bedside, for all that our healthcare workers, nurses, doctors, assistants, everyone that's had a hand in helping us navigate day after day after day. I want to say thank you, because you have gone way up and above and beyond, over and over and over again. I know how tired you are. You're making a huge difference, one family at a time. And for the life of me, I struggle to think about how some folks trust certainly the most lethal virus that anyone living today has been, anyone who's living today has been exposed to, that's had a strangle grip on the world. How you would trust your ability to fight that off, instead of trusting an American-made vaccine that has proven overwhelmingly, statistically, that is saving lives, that has been administered 500 million American doses, 9 billion, over 9 billion worldwide. I mean, these are the facts. And I'd like to say I rest my case, but we have more work to do. And I will say in the upcoming year, I will try to do my part to connect with folks who are trusted for those skeptics. Because it just pains me to learn of these stories of folks who learn through negative reinforcement, when the positive reinforcement will not just save lives, but it'll help us together get through this safer and quicker. I also want to single out two people sitting to my right and to my left, Dr. Box and Dr. Weaver. I think of them as my Patton and Bradley because they approach this as like a warlike effort. And they are two of the, and I think Hoosiers have gotten to know this themselves, but they are two of the smartest, toughest, most compassionate people that I've had the privilege of working with and personally knowing. And that extends to your teams that you've built, but the way that you have also approached every single day with a servant's heart, even with so much difficult information coming in very early in the morning, very late at night, day after day after day, now going on 2 years. I can't thank you enough. Thank you. And it's because of that I am optimistic, and I do look forward to another year working together. There are so many topics. I won't belabor my gratitude, but so many topics to go over today, including the current state of the pandemic in general, but also our inventory levels, changes in quarantine protocols, treatments, some new that are coming online. How do I get it if I need it? Where do I get it if I need it? And so I'm looking forward to hearing what you have to share. I also want to take one thing off the table, if I could, before we get into it, and just let you know that I did sign an extension of the state's public health emergency and emergency order. So, Aaron, if you haven't hit send, please hit send. I have signed that. I'll continue to work with the legislature and the leadership there on my 3 concerns, those having to do with the enhanced federal funding for Medicaid, SNAP benefits, and then, of course, allowing Dr. Box, our state's health commissioner, to serve as our statewide ordering physician for those who choose to be vaccinated, including children 5 and older. So that has been extended. Obviously, given the latest surge that we're experiencing right now and the impact that it's having on our communities throughout the state of Indiana, it's as no surprise that the public health emergency needs to continue. And finally, as this year ends, this is something I alluded to in the past in various venues, but one of the more challenging things or difficult things is dealing with misinformation or disinformation about the virus itself, COVID-19 specifically, and how we make decisions here at the state. And so I do want to acknowledge just the important role that data plays in our daily lives, not just ours, I'm not talking about ours, but ours as a state, and the number of citizens, hospitals, schools that rely on that data integrity to make wise decisions, and all that goes into that, whether it's Fairbanks or Regenstrief or the Department of Health itself or hospitals or schools. This has been invaluable, and we have sought to be transparent from day one. This is the epitome of building the airplane in flight from the ground up and putting out. We just feel like the more you know, the better off we all are. And folks should have a high level of confidence that the data that the state of Indiana puts out is accurate. Whenever you build an airplane in flight, if I have erred, if we have erred, we'll own it, we'll admit to it, and we'll fix it, and we will move on. And ladies and gentlemen, that's how we'll continue to conduct ourselves over the course of the next year. And with that, I will turn it over to Dr. Box for your full report. And I see various pages there, so it is a full report.
Lots to talk about, sir.
Yes.
Thank you so much, Governor, and good afternoon, Hoosiers. A year ago, we came to you to announce the arrival of the first COVID-19 vaccines. Even though they were in limited supply initially, the development of a safe and an effective vaccine that could help save lives was the infusion of hope that we really needed at that time after struggling with this pandemic for almost 11 months. Today, I'd like to be celebrating the incredible work that's gone into getting more than 3.5 million Hoosiers fully vaccinated against this disease and getting boosters in the arms of more than 1.3 million of those individuals. Those are remarkable achievements made possible only by the tireless dedication of researchers, public health workers, the Indiana National Guard, and our healthcare workers across the state. Unfortunately, COVID-19 is determined to keep us on our toes, and we once again are facing a very bleak situation with this pandemic. Our COVID-19 hospital census is at the highest level in an entire year. The number of people hospitalized with COVID has increased more than 700% since late June. Our healthcare workforce is depleted physically and mentally, as are our public health workers. Cases are on the rise, and we're seeing a larger proportion of cases in people age 40 and under compared to this time last year. Cases among children ages 9 and younger have increased from 3% to 10% of cases. Fortunately, we're not seeing higher hospitalization rates in our past data, but again, remember that data lags by a couple of weeks. School cases have also increased before the winter break to some of the highest levels that we have seen in months. As a result, our positivity rate is once again hovering around 14% after falling to 6% in October. All of our counties are in orange or red advisory level, which indicates high activity. Cases in our long-term care, which had been decreasing as residents and staff got vaccinated, have nearly doubled since August. We've been seeing about 1,000 cases in the month of November and December, and recently had 400 cases in less than 1 week. The pendulum has also shifted as residents' immunity has waned and more staff have become vaccinated. More of the cases we are seeing now are occurring in residents instead of staff. We hope to see this improve quickly as facilities complete their booster doses. More than 700 facilities out of approximately 750 have notified us that they have completed their booster clinics, and about 24 others are working to schedule theirs. To further complicate the situation, we are dealing with a shortage of rapid tests. We supply rapid tests such as Abbott's Bionex Now test to local health departments, our own mobile and IMS site, along with entities that include long-term care facilities, schools, and jails. Each week, those sites go through an average of about 50,000 rapid tests. Due to the national shortage, we are only guaranteed to receive about 11,000 Bionex Now tests a week right now. We are actively looking for other sources of rapid tests and have been able to acquire just over 10,000 Quidel QuickView tests. But at this time, we have no guarantees of our future supply beyond the 11,000 Bionex Now tests that Abbott has promised us each week. This is a national problem, not just an Indiana issue, and it's making it more difficult for Hoosiers to find rapid testing when they need it. That, in turn, has led to overwhelming demand at sites like IMS, where people are lining up an hour before testing opens. And now the Omicron variant has arrived, bringing with it a number of new challenges in terms of how easily it is spread. Our first COVID-19 case involving the Omicron variant was detected 11 days ago. This was not a surprise because Indiana was one of only a handful of states that had not yet detected the new variant. The CDC is reporting that 22.5% of samples it has received the week of December the 18th were Omicron variant, and it is even higher in some parts of the country. Omicron cases are doubling in some cities, including Chicago, every 2 to 3 days. We identify the presence of variants through a process called sequencing. This is done by identifying positive cases that have a key marker for Omicron called an S gene dropout and performing further analysis to that specimen to determine whether it is Omicron. Our IDOH lab is sequencing all positive cases that have an S gene marker, and we are updating the percentage of Omicron cases on our dashboard. At this time, Delta remains the predominant variant in Indiana, but we expect that that will shift quickly. Omicron is very easily transmitted and infects and multiplies 70 times faster in the major airways of the lungs of an infected individual. So people infected with Omicron have a lot more virus in their throats, waiting to be expelled when they exhale or they cough or sneeze. The CDC expects that everyone with Omicron infection can spread the virus to others, even if they do not have symptoms or are vaccinated. This situation will get worse before it improves. Based on data from other countries who are further along in their Omicron surge, we expect to see a very steep rise in cases over the next several weeks. We are throwing every resource we have at this. In partnership with the Indiana National Guard, we have deployed 6-person teams consisting of 2 medics and 4 general support personnel to nearly 24 hospitals across the state. These teams are deployed in 2-week increments to help ease staffing issues while hospitals work on long-term solutions, and they can be extended an additional 2 weeks if needed. Right now, most hospitals are requesting that 2-week extension. We've been working diligently to identify additional sources of rapid tests. We've extended our testing and vaccination clinic at the Indianapolis Motor Speedway until January 22nd. Since November 30th, the team at IMS has administered more than 13,000 vaccines and performed more than 10,000 tests. More than 1/3 of those tests have occurred in this past week. In the last 2 days, the team at IMS has done more than 1,500 tests and nearly 1,000 vaccinations. This is an incredibly high volume for an 8-hour period. On Monday alone, we saw a 28% positivity rate among our rapid tests. These data show clearly that we are seeing higher levels of transmission across our state. After seeing the high demand at the IMS, we have added testing appointments for the site and are strongly encouraging people to make an appointment and complete their registration ahead of time. This allows us to move people through the line faster because we do not have to take time on site to register individuals. Even if you do not have an appointment, be prepared to wait. If you do have an appointment, be prepared to wait. The team is working as quickly and efficiently as possible, and your patience is much appreciated. Due to the holiday this weekend, we'll be open from 4 to 8 p.m. today and then resume operations on Tuesday at 4. Our January schedule will be 4 to 8 p.m. Tuesday through Friday and 8 to noon on Saturdays. This allows our team to restock supplies on Mondays. We have more than 650 testing sites across the state, and I want to continue to encourage people to look for testing options in their community. You can find these sites listed on the testing map at coronavirus.in.gov. Due to the national shortage of Bionex Now tests, you may need to get a PCR test. This does take a little longer to process, but it is the most accurate test available. Our labs are working diligently to provide these results within 24 to 48 hours. If you are symptomatic, please self-isolate at home until you can get a test. In addition to the state's effort, the federal government has provided a 20-person Navy team to support operations at IU Methodist Hospital. As we meet the latest COVID-19 challenge, there is also good news regarding quarantine and isolation. The CDC has updated its guidance for isolation and quarantine for people who test positive with COVID-19 or who are exposed to the virus. These changes shorten the times most people will need to spend in isolation and quarantine from 10 days to 5 days. These changes are based on the fact that science has found that most transmission of the virus that causes COVID occurs early in the illness, typically 1 to 2 days before symptoms develop and in the 2 to 3 days after symptoms develop. Based on this information, the CDC states that positive individuals who do not have symptoms or whose symptoms are resolving can leave isolation after 5 days, so long as they continue to mask for 5 additional days to reduce their chance of infecting others. We do know that asymptomatic people who test positive can still transmit the disease, so adhering to the mask guidance is critical to prevent further spread of COVID-19. The CDC also has updated its recommended quarantine period for people who have been exposed to COVID-19. These are for close contacts. If you are unvaccinated or more than 6 months out from your second Pfizer or Moderna shot or 2 months from your J&J vaccine, and you have not yet received a booster, the CDC recommends that you quarantine for 5 days and then follow strict mask use for an additional 5 days if you're asymptomatic. Individuals who have received their booster shot do not need to quarantine following an exposure, but they should wear a mask for 10 days after the exposure. The CDC also continues to recommend that people who are exposed get a COVID test on day 5 after their exposure if it's available. If symptoms occur at any time, individuals should immediately quarantine until they receive a negative COVID test. This new guidance applies to the general public. It does not apply to congregate living settings like long-term care facilities, the Department of Corrections, jails, or to early childhood education. The CDC plans to update its guidance for those settings in the near future. This guidance also does not supersede the recent healthcare worker guidance that was released last week. That guidance allows for healthcare workers who test positive but have no symptoms to return to work after 7 days with a negative test. It also states that exposed healthcare workers who are fully vaccinated, including a booster dose, do not need to quarantine at home. There is no new guidance from the CDC at this time for K through 12 schools. We will be working to incorporate this new general guidance into our school recommendations. I want to emphasize that the ability to reduce isolation and quarantine depends on people remaining asymptomatic and wearing masks diligently for the additional 5 days. If you develop symptoms at any time during those 10 days, you need to get tested and avoid interaction with others until you have your results. As the Omicron variant sweeps across the U.S., it is more important than ever that people use the tools available to reduce the spread of COVID-19. We have those tools in ample supply: masks, hand hygiene, staying home if you're sick and getting vaccinated and boosted. Wear a surgical mask or even a K95 if you can, because they provide better protection against Omicron than a cloth mask. We need your help to ensure that we all use all of these tools diligently. I want to thank all Hoosiers who got tested before gathering with family over the holidays. I know many people had their Christmas plans derailed when their tests came back positive. But by testing beforehand, you helped prevent additional cases, and you have ensured that your loved ones will be around to help celebrate holidays in the future. I know everyone is tired of COVID-19. It doesn't matter if you're a healthcare worker or a first responder or a public health nurse or simply a Hoosier who just longs for things to get back to normal. None of us could have ever prepared for this crisis in this duration. The toll has been enormous. But the best way, indeed the only way, to get back to these pre-pandemic days is for everyone to do their part, and that starts with vaccines. Now, Dr. Weaver will share updates on our vaccination rates, some changes in vaccine offerings at our state sites, as well as treatments and other medications that recently have been approved. Dr. Weaver?
Thank you, Dr. Botts. We definitely have a lot of information to share today. I want to reiterate how challenging the situation is right now in our hospitals. We are seeing significant increases in COVID hospitalizations across the entire state, in addition to all of the other illnesses and injuries we care for every day. Patients are coming in sicker with more prolonged illnesses, likely from delaying care over the course of the pandemic. Our current total hospital census is currently the highest it has been in 5 years, and we're over 1,500 patients higher than our peak last year. Additionally, we have been maintaining a higher census each month since April compared to the last 5 years. I see this every time I work in the ER. We are often seeing patients being held in the emergency room for hours and sometimes days until a bed becomes available, which is difficult for the patient, their family, and for the staff. Patients are being cared for in hallways and conference rooms. On top of the record-breaking census, many facilities are also reporting critical staffing shortages. The hospital clinicians and staff are exhausted. It is heartbreaking to have people arrive in distress from COVID, knowing their severe illness could have been prevented by a vaccine. At this time, I would also like to add a plea to please not go to the ER just for COVID testing. As I mentioned, our ERs are stretched to the limit with very sick patients, and the additional volume of people seeking testing adds an additional strain. I want to re-emphasize how important it is to get vaccinated and to get your booster if you are at least 16 years old. More than 80% of the people we are seeing in the hospital with COVID have not been vaccinated. At this time, just over 54% of eligible Hoosiers are fully vaccinated. Among Hoosiers 18 and older, more than 61% are fully vaccinated. Vaccination rates are higher among our oldest Hoosiers, averaging 80% of the population for ages 60 and older, but the rates fall significantly for people under the age 60 and average just 48% for ages 5 to 59 combined. The rates are especially low for people under the age of 20. 10.2% of children ages 5 to 11 have been vaccinated, 38% of those ages 12 to 15 have received their vaccine, and 45% of those ages 16 to 19 are fully vaccinated. We are encouraged to see that booster doses make up a large majority of all doses given recently. At our EMS site, for example, more than 2/3 of the vaccines administered since November 30th have been boosters. Statewide, boosters represented nearly 70% of doses given last week. Almost half of Hoosiers over age 60 have received their booster dose, but uptake falls significantly in younger age groups. Please get a booster if you are eligible. Data out of South Africa and the United Kingdom show that 2 doses of Pfizer or Moderna vaccine provide approximately 35% protection against the Omicron variant, but a booster dose increases that protection against infection to 75%. The vaccines are proven to decrease the risk of severe disease and hospitalization and death from COVID-19. Please do not give Omicron the advantage. The CDC has recommended that people get the Pfizer or Moderna booster 6 months after their second dose. Individuals aged 16 and 17 can only receive a Pfizer booster. Individuals who received a Johnson & Johnson vaccine are eligible for a booster dose 2 months after they get their Johnson & Johnson. The CDC has recommended that these individuals get a Pfizer or Moderna booster. We are no longer offering the Johnson & Johnson vaccine at our state-sponsored vaccination sites due to its lower efficacy and the CDC's recommendations earlier this month, which raised concerns about the risk of blood clots developing following a J&J vaccine. The Johnson & Johnson vaccine is still available at other sites, but the risks and benefits should be discussed with a medical professional. No matter which vaccine you receive, your outcome from COVID is likely to be much better if you have been vaccinated. We do continue to see breakthrough cases, and they have been increasing. This is not unexpected as we wait for more people to receive their booster dose and Omicron increases. However, it is important to remember that these cases represent a very small percentage of people who are vaccinated. Out of the more than 3.5 million people who are fully vaccinated, we have seen just over 101,000 breakthrough cases since January 18th of this year. That amounts to just about 2.8% of fully vaccinated individuals who have gone on to develop COVID. Of those breakthrough cases, just over 2,000 people have been hospitalized. That is approximately 0.05% of all fully vaccinated individuals. Again, these numbers do not mean that vaccinations are not working. And what these numbers mean is that the vaccinations continue to be extremely effective at preventing severe illness or death from COVID. Unfortunately, nearly half of our eligible population is still unvaccinated against COVID-19. And of those who are fully vaccinated, just over 1/3 have received their booster dose. I have heard many people say that they do not think they need to get the vaccine because they've already had COVID. We do not know how long those natural antibodies last, and many people have wound up getting COVID more than once. During the week of October 24th, we saw 258 reinfections. That number has increased to 1,800 reinfections during the week of December 19th. And today, we're going to be reporting 683 reinfections just for today. It has been reported to expect that the number of reinfections to continue to increase with the Omicron variant, and that the risk of reinfection is 5 times higher. There is also a risk of reinfection within 90 days from the previous infection, and previous infections may only provide 19% protection against Omicron variant. Bottom line, don't rely on natural immunity to protect you. Even if you had a mild case the first time, your symptoms could be more severe the second time if you are not vaccinated and boosted. I also have heard people say that instead of getting vaccinated, they will get one of the new treatments that are coming out to be administered before they are exposed to COVID or as a therapeutic after they are diagnosed. There are a number of different therapeutics available, but all are in very limited supply at this time. This month, the FDA has granted emergency use authorization to Pfizer and Merck for oral antiviral pills that can treat mild to moderate COVID-19 in people who have tested positive and are at high risk for COVID-19, including hospitalization or death. Merck's treatment, called molnupiravir, reduces the risk of severe disease by 30%. It is available only to people age 18 and older who meet the criteria. Indiana received an initial allocation of only 4,880 courses. We have directed those to select CVS and Walmart stores across the state, and they are expected to arrive today and tomorrow. After the supplies have been successfully delivered, we will post the store locations on our coronavirus.in.gov website. Please note, this medication requires a prescription from a healthcare provider. You must be positive for COVID-19 and at high risk for severe illness and hospitalization, and you must start the medication within 5 days of symptoms. It is not recommended for use in individuals who are pregnant due to concerns about possible birth defects, miscarriage, or other adverse outcomes. Even if you meet the criteria, it is not guaranteed that the medication will be available. Again, we have only received 4,880 doses for the entire state of Indiana and will be reporting almost 8,000 new cases today. Pfizer's Paxlovid is another oral antiviral pill that can be administered to people aged 12 and older and who have tested positive and are at high risk for severe disease. Paxlovid has been shown to reduce risk of hospitalization and death by 89%. This medication is also in very short supply. Indiana has received only 1,060 courses in our first allocation. We have distributed those to hospitals because they are best positioned to make the clinical judgment about which patients are best suited for the treatment. Not every hospital has received it, as it was shipped in boxes of 20 treatment regimens, with most hospitals only getting 1 box. We hope to receive another allocation soon, but have not yet heard when that date will be. As we get more supplies, we will work to make sure it becomes increasingly accessible to more retail pharmacies, hospitals, and clinics. The FDA has also issued an EUA for AstraZeneca's Evusheld. This is a monoclonal antibody that requires 2 consecutive intramuscular injections and is authorized for use as a preventive medication before someone is exposed to COVID-19. Initial studies showed people who receive this medication have a 77% reduction of COVID-19 for 6 months after injection. Unfortunately, preliminary data has shown its effect to be lower against the Omicron variant. We received our initial allocation of 960 doses this week, and were allocated an additional 984 this week. The medication is also extremely limited and will only be available for people 12 and older who are not expected to mount an immune response to the COVID-19 vaccines. For example, solid organ and stem cell transplant patients, people with B-cell malignancies, active myeloid leukemia, multiple myeloma on active treatment, people with primary or secondary T-cell immunodeficiency, including severe combined immunodeficiency. Evusheld has been distributed to hospitals who actively care for these patients and will be administered in transplant and oncology clinics. The rise in Omicron will put a significant strain on our already limited ability to provide monoclonal antibody infusions. Throughout December, our state allocation of monoclonal antibodies has been significantly smaller than demand. Monoclonal antibody sites have had to limit infusions to people with active COVID-19 infection and at high risk for progression to severe illness and hospitalization. As Omicron becomes a dominant strain in Indiana, we will no longer be able to use Regeneron and Eli Lilly's Bam/Edi monoclonal treatments, as they have been found to not be effective against the Omicron variant. That will leave us with only one monoclonal antibody infusion, Stratovimab, available to provide Hoosiers who are actively infected with COVID-19 and at high risk for severe illness. Last week, we only received 2,160 Stratovimab treatments, and this week we received 1,122. This will not meet our current demand, and infusion sites will need to prioritize the highest risk patients. If you have received an order for monoclonal antibody treatment and need help finding an infusion center, you can call 211. They can help you find a location and put you in contact with the center, which is responsible for scheduling the treatment. We have transitioned this function to 211 following the end of the federal Crush COVID program. We also have posted a treatment map on our website at coronavirus.in.gov that shows facilities that have these medications. But again, please keep in mind, all of these treatments do require a medical provider to write a prescription, and they're going to be in extremely limited supply. While it is encouraging to see science continue to develop to meet the challenges that COVID throws our way, it is important to remember that there is simply not enough medicine to go around right now. And do not bank on being able to get a therapeutic when you need it. It will take time to increase supplies and distribute these treatments, and none of them are 100% effective. Vaccination remains our #1 defense of preventing severe illness. Please get vaccinated and get your booster shot.
Thank you, Dr. Weaver. Aaron, you want to
Yes.
tee it up?
Yes. All right. Thank you very much. We will first have Emily Longnecker, WTHR. You can step up to the microphone right there.
Thanks for having us. So basically, the message is that the vaccine is the most important method, and people, they have to rely on their doctors to find where they can get these treatments. They need a prescription. I mean, how is it prioritized for folks?
For the therapeutics, you do require a prescription from your provider. There are many sites that will help you direct how to do that if you don't have a provider, including calling 211. They can help get you connected with a provider. But I think the most important message is given how limited our supply is, it really is going to be for a very small part of our population. And those are people who, despite the fact of them being vaccinated and boosted, are at increased risk for severe illness. So those are people who are over the age of 65, people that have immune deficiencies, people with transplants, our oncology patients, and then of course people that are at increased risk for other medical conditions. So it's just going to be a very small amount of people that will be able to get access to it.
Okay, thanks.
Sorry. All right, next question is Jeff Newmeyer, WPTA.
Yes, I guess the main thing I wanted to ask is, with this kind of a not a real positive picture about the hospital, the pressure on the hospitals right now, given the fact that this thing has hung on longer than we think. Another year from now, what kind of picture would you paint about the ability of these staffs to be able to keep hanging in there and being able to deliver service when we still see these numbers continue to be very high?
First of all, Dr. Weaver and I are banking on the fact that we believe things are going to get better. And so we're taking a positive approach to this. I will say that we have lost a tremendous number of healthcare providers. Someone very close to us just told us his wife is leaving an emergency room setting because she just can't do it anymore. And quite honestly, we will continue to lose more nurses and respiratory therapists and physicians from the healthcare profession. And we were already short. So if this continues, and Dr. Weaver and I are incorrect, then we will have significant issues going forward with being able to staff our hospitals. And you can only use the Indiana National Guard and federal resources for so long. So what we need to do right now to help our healthcare professionals is to do everything as an individual Hoosier that we can do. And that is to get vaccinated, to wear our masks when we're indoors in crowded situations, to make sure we stay home if we're infected and get tested. All those things we've talked about now for, we're starting our third year on this. And in reality, I think people will come back to this profession. Pandemic is once in a 100-year thing, right? So we're not counting on another one of these for a while. But realistically, it will take time for us to recover from this.
And I would say, I would just reiterate what I said at the outset, and that is, if you have been vaccinated and you've gotten your booster, that's not all you can do. And if you can appeal to folks who are skeptical of the efficacy of the vaccine, please do that. You may be the person someone trusts that's holding out. I hear these cases too. And it could be at the Y, it could be at church, it could be in if you play bridge with a group, who knows what the group is, but if you are a trusted individual in your cohort, you could make the difference in someone else's family's future. And so, like I said, I'm going to put more of that on my shoulders to try to do more outreach and to equip folks with the compelling evidence that the safest, surest, swiftest way to get through this as an individual and as a state and our country is to get vaccinated, as Dr. Weaver and Dr. Box have said over and over and over again. Anything to add?
I want to agree with Dr. Box. We're optimistic for the future. We have vaccines readily available. We're getting more treatment options. We do think that the next several weeks to month are going to be difficult with the decreased supply, and we know that there's going to be a significant rise in cases. But we need to all do everything we can, like the governor said, and do our role and take a part and try to communicate with our friends and families and get more people on board with protecting not only themselves, but each other.
Yeah, especially as state, meaning Indiana and 49 others and territories, state demand outstrips national supply. And if, in fact, we are to believe what is happening and occurring to others, that our lines will become linear in the next month because of Omicron, et cetera, cold weather, holidays, people coming together, we have to make smart decisions along the way. I'll share that my family Christmas plans changed at the last minute. We were planning on all getting together, and my older brother's daughter was positive for COVID, and so we canceled our plans shortly before Christmas. I'm sure my mother would have loved to have, I'll say see her children, but I know she wanted to see her grandchildren. But we said, look, we'd rather celebrate next year and not chance it and do the safe thing. So there are ways to get together, but if you're equipped with the data, that will help guide you. And then in addition to that, help not spread the infection, spread your prayers, but also spread the data that will help others get through it as well.
Whitney Downer, CNHI.
Hello, Governor Holcomb, Drs. Box and Weaver. So on the legislative side, we recently heard 14 combined hours of testimony on a bill that would limit vaccine mandates, and most of that testimony was flat-out misinformation.
Yeah.
And even our Attorney General is questioning the validity of the data that we have as a state. You know, are you worried that the legislature and other platforms or other people are giving a platform to this misinformation at the highest levels of Indiana government? And what can we do to make sure that this misinformation isn't given more steam to move forward?
Well, that's about as serious of a question as they come, and I appreciate it. I'll take it one by one. I mentioned in the past that misinformation, disinformation was of real concern and worry. It will be, regardless of the topic, but especially in these life and death decisions that Hoosiers are making on a day in, day out basis. They have to have a place of trust. They have to have a place that they can go to for data integrity. The State Department of Health puts that out. It's not just the State Department of Health that comes up with this. As I said at the outset, this is one of the things I'm most proud of during the storm has been the collaboration that's occurred with hospitals, schools, exchanges, Regan Street, as I mentioned, Fairbanks, IUPUI, et cetera. It's been constant collaboration to arrive at accurate information at the end of the day. And so misinformation or disinformation is obviously, by definition, counterproductive to getting through this safely. I will say that I was stunned and somewhat blindsided by the Attorney General when he said he didn't trust any information, because that, to me, hit home. And it's quite serious when you accuse or insinuate anyone of inflating numbers. In my book, that's called fraud. And if there is a shred of evidence, he or others need to take that to the Inspector General of the state of Indiana. There's not when it comes to the State Department of Health. I've already confessed that if we make an error, we own it, we admit it, and we fix it. We take this very personally, not just professionally. And the responsibility that we have to share good information that people at home cling to make decisions about when to go to the grocery store is of paramount importance. And so anyone that is spreading misinformation or disinformation regarding our reporting, to me, is just, I believe, just attempting to fan the flames of confusion. And that's exactly what we don't need at this time. If someone has a question, they need to raise that question with us. And we will answer it. We do this every day, and in all 92 counties. But it is, to use Dr. Box's word, I think, demoralizing to accuse someone of wrongdoing. And I understand people in general, if they do not understand something, maybe they're more skeptical about it. But if you don't understand it, then ask a question, and we will gladly answer it.
Adam Pinsker, Wish TV.
Good afternoon. First question, you mentioned a shortage of testing kits. President Biden said a few weeks ago he was going to try to get those to the states or get those distributed. I don't know how that works. Do you call the White House? How does that work?
He's on my Fave 5, right? Is that what you're asking? Well, yes, we do request on a weekly basis all kinds of things. And if I had one suggestion, it would be to get those $500 million back to the states directly. This is I was at a CVS yesterday buying toothpaste. Another confession in the morning, and the clerk that was checking me out took multiple phone calls while I was standing there and had to say that, no, they did not have tests available at this time. And so I come back, and when I have a question, I go to these two. I said that from the very beginning. I said, well, you know, how many around the state are in this very same position, and where are they, and how long, et cetera, et cetera, et cetera. So those 500 million are now off the table. They're purchased, they're bought, and they're going to be able, Americans will be able to access them at some point next month, quantity to be determined, but at some point off of a website. We need it now. And I think I could speak for other governors. This is not a partisan statement whatsoever. We need it now. There is a state shortage and a record demand. And so yes, we are appealing to get everything that we can, regardless of whether it's testing or treatments, et cetera, because we need more of all of it.
During the height of the pandemic last year, a lot of our state's prisons and county correctional facilities had numerous outbreaks, and people kind of think maybe they've been overlooked. How are you getting them boosters, tests, things of that nature? Is that something you guys are, Dr. Box, Dr. Weaver, are working on?
So we have partnered with Department of Corrections, with long-term care facilities to assist them in getting the boosters and making sure that everybody that wants a booster is able to get that. We continue to partner and provide testing to our long-term care facilities, Department of Corrections, our jails if they're interested in that. Some of our schools are actually using some of the quick tests also. And that's really where we have to put most of those. The rest of them we put at our sites because so many people want to have the quick test when they come. But in reality, we do have more access right now to PCR testing, which I know there's a delay in getting that result, but our labs are able to turn that around within about 24 to 48 hours. So, you know, we are going to have to get through this the next couple of weeks, and I hope that the federal government will get these 500 million out soon. But it does seem a little like there's some deja vu here with what we experienced at the very beginning of the pandemic.
And you talked about the congregate living settings, and you mentioned IMS, but we have strike teams and mobile teams.
Oh, when I say our teams, I mean IMS, and we have strike teams out. You know, we have our mobile teams that are out all over the state.
And just one more to follow up on a previous question regarding some of these items coming to the legislature. If that House Bill 1001 came to your desk and would undercut your authority as the chief executive of the state, cherry-picked a few things out of there, would you sign that bill?
I'll let you know when I see the bill as written, and we're not there yet. But I'm focused on making sure, and I'm, you know, there's unanimous agreement that the three things that I have requested need to be passed. I'm happy about that. Everything else to be determined.
Abdul, Indy Politics.
Hi, guys. Good to see you again.
Hi.
Good to see you.
I want to go back, Governor, to Attorney General Rokita's comments about not believing the numbers, saying this has been politicized from day one. In a nutshell, he's saying that at best, you guys are fudging the numbers. At worst, he's calling you all liars.
Yeah.
What are your thoughts or reaction to that?
I'll let him speak for himself. All I know is what he said and what I read, what I saw him say. And when he said he didn't believe any numbers, I take the state as included in any numbers. If he doesn't believe that, he could very simply clear it up and say very clearly, one sentence, I believe the numbers that come out of the Indiana State Department of Health. That's it. Those numbers are accurate. If there's any accusation otherwise, legal, that becomes legal very quickly, and he needs to get it to the Inspector General. And they can clear it up. If it is confusion, we can help. We can help. And that goes for anyone in the state of Indiana, not just office holders.
Lindsay Stone, Fox 59.
Good afternoon. No restrictions were announced today despite the picture that you each have painted of what's going on. So what led to the decision not to enforce new restrictions? And then of course the follow-up there is, what are you looking at to determine if that will change in the future?
Well, we'll continue to, the reason I extended it is we'll continue to make sure that we're getting the information out according to the local communities. Local entities have the ability to apply more restrictions as they see fit in the state of Indiana. And so we'll continue to go down this road. We have been working diligently with local leaders, office holders, folks in public health, et cetera, to make sure that we're equipping them with the decisions and the information so they can make the best decisions across the state.
A lot of football fans watching right now, the college football championship coming up soon. Any thoughts that you can share on what will look like in the next few weeks?
Well, I mean, obviously, we'll be paying very close attention to the local protocols that are contemplated and potentially put into place. I would say better safe than sorry. We proved by hosting 68 teams, ultimately, I guess, during March Madness, that we could pull something off on that scale. Now, it's a different time. I get it. It's months later, and we'll have to contemplate different input, and that's exactly what you're in constant communication with Dr. Kane and her team, as are you, and so we'll be watching, and we're here to help.
John Russell, IBJ.
Good afternoon. You've said all along that reopening the economy, keeping businesses open and running is one of your priorities. It's a tough balancing act during this crisis. Business leaders and public health groups have called for the authority to lay down vaccine mandates for their workforces to keep their workplaces safe, and protect customers, suppliers, co-workers. Would you support them in allowing them to continue to roll out vaccine mandates for employees?
I do for private business. I do support that, and you know there's a full spectrum there. But I can completely understand whether it's a small business, medium-sized business, or large business. Whether it's a cruise ship, you know, we're seeing all kinds of negative information come from the lack of control, and I trust a business to make wise decisions when it comes to making insulin or ferrying people around the world on a cruise ship. So yes, I support that, and at the premise of your question, my placing importance on that balancing act of lives and livelihoods. I mean, our economy is very important to society's needs. And this is kind of a tale of two cities, but we're living through this time of boom where we're setting economic records, whether it's people moving to the state of Indiana in the Midwest, whether it's people simultaneously during Omicron, during Delta, during every variant that we've lived through to date. We're looking at record revenue, record reserves, a record year at the Indiana Economic Development Corporation in terms of new payroll coming to the state of Indiana, new job commitments coming to the state of Indiana, record amount of capital investment coming to the state of Indiana in 2021. And we're going to be reliant on that to serve all the needs that come out of this pandemic that are here right now and the long tail that can kill you down the road. And so, yes, I've got eyes on both sides of the ledger, and will continue to.
Devin Ridgway, WTIU. Caitlin Lang, Indy Star.
Hello, I just wanted to seek clarity on one thing regarding quarantines for schools. Should they continue to follow previous state guidance that's been released? And when will we expect an update to come on that? And then my next question is regarding Senate Bill 114, which would prohibit vaccine status discrimination, basically preventing companies from mandating vaccines or requiring those who aren't vaccinated from getting a negative COVID test like we've seen in the entertainment industry. I'm curious if you support this policy.
I can answer the second question first, and then you can go to your comments about schools. This is going to be something that I have to sit down with members and leaders in terms of the actual bill. I think they know pretty much where I am on this issue, but I'll want to see the actual language, and it'll be here sooner than we know it, meaning next week.
So CDC plans to come out with additional school guidance for K through 12 sometime in the near future. We know our kids are going back to school on Monday, so basically we will have a seminar, basically a webinar tomorrow with school nurses and also with our local health departments, and be rolling out our recommendations based on the general public recommendations for quarantine and isolation.
So to clarify, we should be getting those recommendations tomorrow?
You'll see them quickly, next 24 hours or so.
Next question, Nikki Dementri, RTV6.
Hello. So one question, I wanted to go back to vaccines. I know you guys just talked about it again. The way to get out of this is vaccines. Yet we're still at a little bit above 50%. What plan do you have heading into next year to get that additional 50% on board and get them vaccinated, get them boosted? What's the new message now?
I can
Go ahead.
I can take that or a crack at it. Look, this is. I've been told that we're through converting people from very knowledgeable folks in the trenches that are caring for the very sick. And they've said, Eric, you're not going to get through to anyone else. You're not going to convert anyone. Having said that, others can. And I think that's critically important that we make sure, and we do, but we have to do everything we can to equip trusted, credible thought leaders within someone's sphere of influence. And that's how we'll continue. Otherwise, the only time I hear people change their mind is when through loss. And that's beyond tragic. And so we'll continue to try to get out. We know of examples where a thought leader in a church has massive influence over a congregation. And if we can get the evidence, and you hear it from, day one, from the start of the pandemic, the number of cases and hospitalizations and deaths of the unvaccinated are 95 plus from the very start, and 80 in November and above. Mm-hmm. So we'll continue to try to get the information out to people who can change others' minds. And I'm not too proud to admit, if I can't change your mind by now, it doesn't mean I'm going to quit trying, but I'm also going to look for others to help. And that's my appeal going into next year. Anything?
Well, I think if you talk to behavioral health specialists, they'll tell you that a really important part of this is if you are close to someone, they trust you, it's important to listen to them. Yeah. What are the barriers that exist for them to get vaccinated? What are the fears? What are the concerns? What are the barriers? What are their experience with vaccines or immunizations? And because we come, loaded with a lot of data and a lot of information. And as someone else told me from Northern Indiana, that line in the sand has become a huge chasm, right? It's wider and deeper than it's ever been before. So I agree with the governor. It's going to be from people that individuals trust, and we do need to take time to listen to them and find out what are those things that may be a barrier to them getting vaccinated.
It turns out a grandchild or a child could influence their parent just like a parent or a grandparent could influence their child. It's where we find ourselves. And if you love someone, try to appeal to them to see the light.
Margaret Mang, Center Square.
Hi, Governor, how are you?
Good, how are you?
Dr. Box. I wanted to go back to what you said at the beginning of the press conference about really making sure people have good information. And One thing we haven't heard from the state of Indiana as the vaccine has been rolled out and people have been urged to get it is any mention of risks. All vaccines have risks associated with them, as I'm sure the doctors are aware. In terms of what we see in the vaccine adverse event reporting system, the government's own reporting system, there are more reported injuries and deaths from this vaccine, the COVID vaccine, than any vaccine in the 30-year history of VAERS. It's very concerning. Just in Indiana, we now have almost 1,500 ER visits reported following vaccination. That's just what's reported. It's a passive system, as you know, and only a small fraction of incidents get reported. It shows 150 deaths following vaccination. So we don't know what the real numbers are, but these are really big numbers and really concerning. We had a physician testify before our legislature right before Christmas that with the swine flu vaccine, I believe it was 50 deaths nationally, and they pulled the vaccine. So I think there do seem to be trust issues in the state with the information. But if you can just tell me, Governor and Dr. Box and Dr. Weaver, why have you not, as you've promoted the vaccine, let people know that there are risks associated with the vaccine so that they can give informed consent? I think it's an important question that I don't think has been asked, and I'd be really curious to hear an answer. Thank you.
I'd politely disagree. I heard some
Yeah.
risk analysis even today, and I've heard you many times in the past, so you want to...
I think Lindsay probably wants to take
Well,
that.
I'll address the vaccine adverse event reporting system. So for people to know, anybody can go in and report in there, which is very important. But that means anybody who maybe happened to have a heart attack in the couple of weeks after they got the vaccine would go in there reported. And we do get to see those cases at the state, and they are reviewed, and they're also reviewed by the CDC to see if there truly is if what's being reported could be associated to the vaccine. And we have not seen that to be the case in the events that we're reporting. In fact, in the very beginning, we did talk about a small risk of having an allergic reaction in the short time after you receive the vaccine. And I'm happy to say that we have not had that happen at any of our Indiana Department of Health sites where we've had EMS available to treat that. And that does happen with some medications and some vaccines. People can have these allergic reactions, but we haven't even seen that at any of our sites, and have honestly, over time, proven to be more and more safe and effective. And we are responsive when we do feel like there could be a risk. So they did come out with that very, very small risk for the Johnson & Johnson. And we do feel that it's still a good vaccine for people who only want to get one shot, and that's something that's important to them. But we think that they should talk with their providers before they make that decision. And so that's why we did pull it from our sites, but are still supporting it being other places so people can have those conversations. I mean, we've had billions of people across the world vaccinated with this, and we're not seeing any of these people have any adverse reactions. Do you have anything to add?
And I think the important thing is to say when we do see something that truly is an issue like the J&J, we discussed it and said, every person that gets J&J should have a healthcare professional that counsels them with regards to the risks and the benefits, even though it was 9 cases out of 17 million cases of blood clots in the brain. So we are watching that and trying to adjust what we're doing. And our sites are quick sites. They are Indiana National Guard and other individuals that, even though we talk about the risks with them, it is a very brief thing, and it's not the kind of conversation you would have with your own private practitioner.
And I would just add, we always encourage people to have conversations with their clinicians before they do anything. And so I think it's appropriate to talk about which vaccine is right for me. And I know that our providers are happy to provide that information and talk to them about it. There's a small risk with every medication that there is, but honestly, again, these vaccines have proven to be very safe, very effective.
And some of these adverse effects that occur, what they look at is what is the background that you see with even getting a viral infection, right? You're going to get Guillain-Barré. How many people get Guillain-Barré just from the fact that they have a viral infection with COVID-19? How many people get myocarditis? with getting an infection from COVID-19, and that is much larger than the number of kids that get myocarditis associated with getting the vaccine. So those are things that Dr. Weaver and I are looking at on a regular basis. And we have at different times discussed those different statistics, and we'll be happy to answer questions that people have about that.
Lauren Chapman, Indiana Public Broadcasting.
Good afternoon, Governor and Drs. Box and Weaver. First things first, Governor Holcomb, have you spoken to Attorney General about have you spoken to Attorney General Todd Rokita about his comments, or have you had any communication with him since?
No, he's not reached out.
Do you have any intention of reaching out to him?
No.
Good enough answer. We've talked about the efficacy of...
I'm happy to answer any question. I'm not avoiding him. I don't have anything to clear up.
We've talked about the effectiveness of masks to help limit the spread. Dr. Box, I believe, brought up the KN95s and the surgical masks. Is there any desire, possibility of bringing back a statewide mask order? Are you encouraging local governments to bring back their own mask orders? I know Marion County still has not brought back their own mask order.
We are certainly, as we talk with our local health departments and providers, continuing to recommend strongly and encourage that the way to get through this Omicron surge is to have everyone be masked, especially inside, and when they're in large groups outside, in addition to getting vaccinated, et cetera. But realistically, we are not in the process of planning a statewide vaccine mandate. Statewide vaccine masking.
Okay. And then last and certainly not least, Governor Holcomb, will you tell IOSHA to comply with the federal vaccine mandate?
We'll see how the case ends up. We've got until probably 10 days into January, and we'll see how the Supremes rule, how the court rules, and then because we're a state-run state, we'll have 15 days to put a plan together if needed, and 15 days to implement it if needed. If not, then no.
All right, thanks so much.
Thank you, Lauren. We have two submitted questions. One is from Steve Garbas, KPC Media. At the end of our second calendar year, Indiana now sits at more than 18,000 Hoosier lives lost to COVID. Can you comment on this continuing toll and whether you expect it will improve in 2022, considering how low our vax rate is?
So,
I feel like you've answered that.
well, I think we will continue to lose more people than we need to because people are not vaccinated. Even our elderly people, especially in our long-term care facilities that are vaccinated and boosted, are still at risk because of their age, because of their underlying comorbidities. So the way that we protect those children under 5 and those very elderly people, those people that are immunosuppressed, is for the rest of us to get vaccinated. So unfortunately, yes, Indiana will see more deaths than we need to see because of our vaccine rates. I do believe that this is going to get better and go down. I'm still very optimistic about that, but I think we have some high numbers still to go through in the next 4 to 8 weeks.
And the last question, as mentioned, the CDC cut the time for quarantines for those who test positive for COVID-19 from 10 to 5 days. Many people have remained infectious long after 5 days. Does the ISDH support this change?
I really do, because the data and the science behind that is that 85 to 90% of people are no longer infective after day 5. So consequently, if you look at this, there's another 10 to 15%, and we're really picking those people up by mandating or asking, requesting strongly, if you want to follow these guidances, that you need to be